Welcome to our session on misinformation and United Facts of America. I'm John Greenberg, senior correspondent with PolitiFact at the Poynter Institute. Thank you for tuning in. We'd like to thank our sponsors for today's event. And to those of you who have already donated to PolitiFact or Poynter, thank you for helping to make this possible. It's always easy to give. Go to poynter.org/support. Right now, we're going to dig into the storm of misinformation that has permeated the COVID-19 pandemic. In the biggest health crisis in a century, we've seen common sense undermined by political talking points and strange conspiracy theories. People have heard and believed that vaccinations come with embedded microchips. That's false. They've heard that doctors and hospitals inflated the death count to make more money. Also false. Public health hangs on getting accurate information to people, and that happened. But what we also got along the way was a good dose of the exact opposite. It didn't help that in too many ways the White House was part of the problem. Many people threw themselves into the fight to get the real facts in front of people. We just heard from Dr. Dan Fabui talk about encouraging people of color to get vaccinated. He went on Clubhouse, Twitter, and Facebook to beat back the myths. We're joined now by three journalists who've been part of the effort. We're going to talk about what they saw going on, and we'll get their thoughts on why it's been so difficult to get on top of this problem. And maybe we'll even hear some solutions. Shefali Luthra covers the intersection of gender and healthcare at the 19th. Before that, she was a correspondent at Kaiser Health News, where she covered national health policy for 6 years. Elizabeth Rosenthal is editor-in-chief of Kaiser Health News. She spent 22 years as a correspondent with the New York Times. Elizabeth is also a trained physician. She worked at a New York City emergency room before switching to journalism. Derek Thompson is a staff writer at The Atlantic, where he writes about economics, technology, and the media. He's the author of Hitmakers and the host of the podcast Crazy Genius. Thank you all for joining us. Glad you could be here. Elizabeth,
Good to be here.
You interviewed Dr. Anthony Fauci last November, and this was at a point when cases were going up, up, up. And Fauci said the biggest problem was people didn't think the pandemic was real. Was that simple denial, or do you think that there was some intentional false messaging at play? What was up?
Well, I think it started at the very beginning of the pandemic, where people in the United States were not used to the idea that an infectious disease could cause this kind of disaster. So, they'd heard about SARS, they'd heard about bird flu, they'd heard about MERS, but the US hadn't experienced a pandemic, so it didn't seem real. And all our preparedness was geared toward to not real terrorism. This is real terrorism, but we forgot about the terrorism of nature. So it was fertile ground for people to not believe that this could happen here. Like, oh yeah, that happens in China, but and in India, but it doesn't happen in the US. What they forgot, because I lived in China during SARS as a New York Times correspondent, is in those days it was very hard for Chinese citizens to get on a plane and come to the US. They couldn't get visas. There were very few flights. In the 20 intervening years, the world is so much more interconnected that we are extremely vulnerable. And so there was a wanting to disbelieve that we started off with that made everything harder, especially in the face of an administration that, said, oh, I don't want, Donald Trump saying, I don't want people coming off of that cruise ship because that will make the numbers look bad. So there was, we started with a foundation of falsehood and willingness to not look at the truth.
Well, certainly inexperience, but Shefali, there was no shortage of coverage of what was going on. There were the personal stories, the media reported the straight up numbers. And in spite of all of that, it was hard for the truth to get traction, right?
Yeah, and I think that speaks to a host of factors, right? I mean, there's like a whole body of political science research that shows that information that's true often just has trouble taking off, right? And things that are not true, misinformation, especially when it's particularly inflammatory, it just spreads more easily. And I think we can't underestimate the importance of that. But another thing for us to think about as journalists, right, is the role that we played in understanding how people consume information, right? Because we focus so much on the new thing that happened when sometimes people need to be reminded of the bigger picture context, right? Even if that's not actually news, just sort of having it explained to them in channels they actually consume, right? Whether that is through really specific media or through different kinds of social channels, right? Maybe WhatsApp or other sorts of things that other people are using. And I think if anything, the pandemic helped us understand that we need to be a lot more creative and thoughtful about how we get people the information that they need in a way that they can actually internalize it.
Derek, I think that Shafali says people had a hard time absorbing this information, but there was also sort of active resistance against accurate information. And in one way, the numbers certainly became political, which probably didn't help the situation a whole lot. We've since learned New York Governor Cuomo was downplaying the deaths inside nursing homes. Florida, as things spun out, was, pinging around on the numbers. How do you think that made it harder for people to trust the actual numbers so that they could say, yeah, this pandemic is real, people are dying, and in these numbers?
Yeah, there's no question that especially throughout 2020, President Trump served essentially as misinformer in chief. And we're still dealing with the aftershocks of Trump lying over and over and over again about just about every aspect of this pandemic that you can possibly lie about. Today, of the 20 states that are vaccinating the most people per capita, all 20 of those states voted for Joe Biden in November. Of the 13 states that have administered at least one dose to less than half of their population, 12 of those 13, all but Georgia, voted for Donald Trump in 2020. So you see already, and we'll get to this more in a second, that the political gap that exists in this country became a COVID gap, and that COVID gap has become a vaccination gap. At the same time, I don't consider myself, a liberal activist journalist. I consider myself, frankly, a left of center person who's also a journalist. And when I look out into sort of the fonts of misinformation in 2020 and in early 2021, it hasn't just been Republicans. There are also public health officials, including public health officials that would seem to lean left, and liberal governors and senators that have sometimes, I think, miscommunicated exactly how this virus works. Last winter, California shut down playgrounds and urged people not to exercise or run on beaches outside. That doesn't make any sense given what we know about how this virus transmits. So I think it's really important, if we're going to be responsible journalists, to, yes, call out the misinformer in chief here, but also keep our eyes open for the fact that sometimes it's not just the conservatives who I think are misinforming the public about this virus, which is very complicated, and how exactly it transmits.
So, I totally get your point about California and shutting down playgrounds and so forth, but I definitely remember speaking to a Boston University epidemiologist. And I said, when I go biking, I give people about 6 feet distance and I'm not wearing a mask. She said, well, I'd feel better if you had 10 feet. Now, this was early on, and this is a very sort of genuine response. And I think that what I wonder was taking place throughout is, and Elizabeth, I'd like you to chime in on this. We were learning more. We were ultra cautious in the scientific community. Then understandings shifted. And I wonder if that evolving picture made some people less certain of what to believe and perhaps opened the door to more misinformation.
Yeah, and I think that's certainly true. And I wanted to add one thing to the early 2020 picture. COVID landed both in a place that hadn't experienced pandemics, and it landed in democratic strongholds at a time when the country was deeply divided. So The middle of the country, Texas, could say, oh yeah, that's happening in New York. That's not going to come here. But, so there was this denialism there. But I think the point you're talking about now is really important, that, and we were not very good at communicating this. As the science evolved, the advice evolved, and the right mostly, and the public heard that as flip-flopping. So you hear over and over again, well, Dr. Fauci flip-flopped on masks. He didn't flip-flop. He said what was true and what we knew at the time. And this was a new, very unpredictable virus. So of course things change. And it wasn't flip-flopping, it was evolution, but somehow we all kind of accepted that term as legitimate.
Shefali, speaking to that whole business of masks, they really, from my point of view, things got weird. Wearing a mask sort of became like putting a political bumper sticker on your car. It wasn't just a public health measure. Now we had this shift of position within the public health community in Washington. In March, they're saying, don't run out and buy a mask, it's not going to do you any good. By April, at some point, they're saying, get a cloth mask, any kind of mask, it's going to do you some kind of good. And I just wonder, do you have an understanding as to why the CDC stumbled on this point? Maybe you disagree that they stumbled, but I think, would you say it hurt their credibility going forward? And why did it happen?
I think Libby spoke to this point really well, right? Which is that scientific communication is really, really difficult under the best of circumstances. And these have not been the best of circumstances, right? We had a lot of factors going into the mask recommendations, right? Whether that was concern about having enough for healthcare workers, which has been debated since then, but was a real concern. We had healthcare workers wearing N95s for weeks. That was really, really dangerous. At the same time, I do think it's incumbent upon the journalists who are covering this information to remind people how scientific recommendations are made, right? And even when health communicators aren't doing a great job communicating, we should do a good job communicating. That is our literal job, right? And to help people understand that these recommendations came from a whole collection of values and limited evidence, and that they could change as we got more evidence. And in fact, did change as we got more evidence and as the context changed. I think it's really important for us to think moving forward how we covered this sort of scientific consensus building to help readers understand that it's not always a bad faith error or a lie, which I think a lot of people accuse the CDC of doing, when really it was just we had different context.
Derek, I get the feeling you might want to chime in on this. Am I right or wrong? You're muted, so whatever you have in mind.
I didn't want to chime in. I wanted to remain on mute while I moved my mouth. My feeling, this is a big complicated topic, and communicating honestly about an evolving understanding is very, very hard. If you ask me if the US public health communication system, public health communications apparatus did an A+ job communicating about this virus, I would say no, it did not do an A+ job. If you're looking for the A+ example, I would say, look at Japan. Japan in April of 2020, right? Over a year ago, was telling to its people, avoid the 3 C's: closed spaces, crowded places, and close contact settings, especially conversations. 14 months later, given everything that we've learned about this pandemic, that's still just about as good as you can do. Sometimes the way that I frame it in my articles is that I say SARS-CoV-2 and COVID-19 is essentially an indoor/talking disease. It spreads very efficiently indoors. It spreads very efficiently in the aerosolized particles that are created between people that are talking or singing or breathing exertedly, as in gyms. But outside of those scenarios, it doesn't transmit as efficiently. And therefore, we should push people to normalize their lives as long as they're not doing this indoor talking thing and avoiding the 3 C's. That would mean spending more time outside, taking more runs on the beach, spending more time with your puppy and your baby in parks, I think we would have been in a better position today if we had communicated the simple 3 Cs or the simple indoor talking vibe about this disease, rather than have these very politicized debates about individual aspects of the disease, like where you should and shouldn't wear masks. People can derive mask behavior if they understand the 3 Cs. If you look at Japan's experience in the pandemic, I think they've done really, really well at avoiding it. So I do think that this is big and complicated. I don't want to sort of, throw a whole bunch of blame on the FDA and certainly the CDC here. But I think we could have done a better job communicating this in a simple and honest way.
I do want to
Go ahead, Shefali.
I just want to throw one more thing in there that I think is important, right? Is when we think also about the context of where our public health infrastructure was coming into this pandemic. And I mean, KHN has done a fabulous job covering this. It had been decimated, and health communication is hard. It requires expertise. It requires money. And we hadn't invested at all in doing that. And I don't think it should be a surprise to any of us that it was, as a result, much harder to effectively adapt and communicate and engage with the public about masking and other sorts of factors in the virus's spread.
Yeah, and I would, if I could add to that, can you hear me? I can't quite tell.
Yes, you're good.
That, I once a week I look at the South Korea death statistics, something like 1,600 deaths since the beginning of the pandemic compared to what we've been through. But these are countries that A, have a tradition of mask wearing, so it's not as hard to just get people to do it. And B, there is a central trust in public health. We leave it to like every city, state, building to decide what they want to do. And that's, you can communicate all you want, but in a highly divided nation, people listen to the advice they want. And look, Donald Trump found Dr. Scott Atlas to stand up there and be a doctor and say things that were not scientific. So I think it was bound to be a mess, but we lack that central societal feeling about public health and what it is in this country, which makes the whole thing really hard when people choose who they want to listen to in the media and among the experts.
So clearly huge trust issues with experts kind of feeds into sentiments of anti-elitism, people making decisions about our lives. But I do wonder, Elizabeth, that when we look at the way Trump approached this, there was a kind of a freewheeling quality to his style. That he did swing around on masks. At first, he says he dismisses them. Then for a little while, he took them seriously. Then he was essentially dismissive. Again, we all remember the scene on the balcony where he sort of takes off his mask. And then the hydroxychloroquine, just putting that out there. And I wonder if that kind of set a tone of kind of a bit of a Wild West of information that created space where misinformation, other actors could come in with their misinformation because it would seem possible. What do you think?
Sure, I think that's very true. And I think there are two kinds of misinformation. One kind is misinformation that sounds plausible, like that Tony Fauci flip-flopped. Like you could hear that and go, oh yeah, he didn't want masks at the beginning, now he does. But the stuff about injecting bleach, some of it was just la la land, and yet so kind of plausible misinformation as opposed to wacko misinformation sounded kind of reasonable in comparison. And I mean, I think one thing that the Trump administration did very effectively was to open the door to that, because, for example, when the president himself got COVID, he didn't say that he'd gotten all these treatments to help him get better. He said, nah, it's not that bad. Look, here I am standing talking to you. So he threw the door wide open and, crowds rushed in.
Derek, you wrote about this guy, Alex Berenson. He's a former New York Times reporter, Yale graduate. I mean, those are nice credentials. And you called him the pandemic's wrongest man. Can you tell us a little bit about him? And what was like one of the most wrong things he said? And how did he get his message out there?
Yeah, so Alex Berenson is a spy novelist who also wrote for the New York Times a couple decades ago. And he's become a very prominent COVID skeptic and vaccine skeptic. His COVID skepticism, I frankly don't know that much about. I really started to follow his Twitter feed, which is voluminous, around the turning of 2020, 2021, and recognized that he was just full of these plausible sounding facts that didn't make contact with reality. I've compared him to sort of like an ancient Egyptian geocentrist, this person who can like look up at the stars and tell you like that's a star and that's a planet, but think it all revolves around the earth. So he has 1,000 factoids, but he doesn't understand the big picture. So here's what I did. I thought he was full of BS. I emailed him and I said, Alex, I want to understand your strongest case against the vaccines. Give me your best shot. And I want to write about and scrutinize your strong case against the vaccines. And what I'll tell you is this: every single falsifiable fact, every fact that you could fact check and potentially prove to be wrong, I fact checked and proved to be wrong. He blamed the vaccines for causing deaths in nursing homes that actually had nothing to do with the vaccine. He blamed the vaccines for suppressing our immune system by pointing to a fact that actually suggested totally normal immune system behavior. He suggested that Israel was having a terrible time with the vaccines. If you look at the Israel graph today, you'll find that since January 13th, daily COVID cases in Israel have fallen 99.5%. Yes, 99.5%. And he implied that for most non-seniors, getting the vaccine was more dangerous than getting COVID itself. That's also a terrible lie. So what I did in this article is that I went boom, 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 boom through all the facts he gave me and showed how even sometimes I would email a scientist who provided that fact, and the scientist would say, no, this is a total misunderstanding of my article. It was a little bit like the, Annie Hall, where Marshall McLuhan comes in and says, nothing of my work. There were a lot of experiences like that with the scientist. So basically, Berenson is a very voluminous liar who I showed to be essentially trafficking in a bunch of BS about the vaccines.
And what was his platform? Twitter?
Yeah, he's got a lot of Twitter followers, and he also publishes Amazon Kindle singles, so short books that he goes on Fox News and asks people to buy, and then he goes through all the ways he thinks the vaccines are dangerous in those books. And essentially, what this article did is take the most important aspect of those facts and show them to be wrong.
Okay, so presumably he goes on Fox News to sell his books in some fashion, right? Fox News wouldn't put him on if it didn't draw viewers. So I wonder what Shefali, Derek, Elizabeth, whoever wants to jump on this, is misinformation a business model? And was that part of what we saw?
I'll just answer it really quickly. It's obviously a business model. This is someone who I think realized there was a lot of money to be made in downplaying the virus by criticizing public health experts. That's the key. There was a lot of money to be made by criticizing public health experts throughout 2020 and say, they're lying to you about COVID, this disease isn't as bad as they say, and so forth. So you turn to 2021 and suddenly there's a cure. There's a vaccine. So what do you say? You've always been saying that this disease is no big deal, and it looks like we might have a vaccine that's going to end the pandemic. Your new business model has to be to continue saying that the public health officials are still incredibly wrong. And so he's taken a business model of essentially complaining about public health officials and just extended it into this sort of anti-vax narrative that he's picked up recently.
And I want to say it's also a political model to the kind of a successful political model, COVID disbelief or COVID denialism. And one of the things that really made me nuts this year is some of the politicians who downplayed the importance of COVID or the vaccine, and yet they and their wives and their children and various people they knew were the first to get the vaccine. So, but it worked politically to keep saying no, don't get the vaccine. You can still see op-eds and all over, conservative religious colleges telling all the students there, don't get a vaccine. It's a hoax, um, terrible.
And I think in some ways, John, right, that's also just a very natural progression of where we've seen, in particular, partisanship map onto basically everything in healthcare, right, for decades. This is what happened to abortion. This is what happened to the Affordable Care Act. Things that, in theory, could be divorced from politics, at the very least, with the ACA, are so complicated, right, that people didn't have natural views of them. But once you have very high-profile political figures making these statements on them, it becomes like a scammer's paradise, right, for talking about these in a way that really appeals to people's innate ideological views rather than any actual sort of factual place that we can then engage with in the ways that at least we traditionally would understand as journalists to do.
And I would take it back one step further, that I think the seeds of this were planted in climate denialism, that became a political issue too, whether you were on the right or the left, is whether you believed in climate change or global warming. I mean, these are scientific facts, both about the climate and about health, that, it's now become politically advantageous to deny, and commercially advantageous too, apparently now.
I wonder, we've been talking about our collective failure to communicate very well, but a lot of coverage was really very strong and very compelling. I don't want to beat up on the CDC, but a question came up in the chat or the Q&A, which asked about the CDC and its recent recommendation, where it said there's less than a 10% chance of getting infected outdoors. And then the New York Times writes a piece where it says, hey, actually the risk is closer to less than a 1% chance. And I wonder if you think there's a lesson here for government agencies, let's just leave it to that, for how they should try to communicate with the public, because the CDC has been, can't fault them for being, I suppose, too cautious, but in fact, in this context, they seem to have been too cautious. Derek, do you have a take on that?
Yeah, I do. Let me be careful about how I word this. In most normal situations, no one listens to the CDC. I don't mean that to mean that the CDC should not be listened to. I mean it as a description of reality. No one in a non-pandemic is regularly consulting cdc.gov information to learn how to live their daily lives. If you Google eggs, salmonella, CDC, you will find the CDC discourages the cooking of soft boiled eggs or sunny side up eggs with runny yolk for fear of getting salmonella from the runny yolked eggs. I eat runny yolked eggs 4 days a week, sometimes 7 days a week. I eat it constantly. Am I denying the CDC? No, I'm just recognizing that the Centers for Disease Prevention and Control, or Control and Prevention, are simply extremely precautious in their advocacy, in their health advocacy to the American public. Now we're living in a pandemic. These are abnormal times. We're often consulting the CDC for learning how to live. When do we wear a mask? How do we behave outside? How do we behave in a grocery store? Can I go on vacation? We're asking an extremely precautious public health institution to advise us in our daily lives. So in a way, you could say it's somewhat inevitable that the same institution that would advocate against soft-boiled eggs would also have an overly precautious attitude on dealing with a pandemic. But that doesn't mean, that sort of natural inclination of the CDC to be overly precautious, doesn't mean that sometimes we can't blame them for being clearly too precautious. they've taken way too long to be clear about fomite transmission of this disease. That is to say, surface transmission of this disease. 15 months ago, we were all washing our vegetables and washing our hands 17 times a day and never shaking hands and wearing gloves. We now know that SARS-CoV-2 does not spread very efficiently from surfaces. It's an aerosolized virus that is mostly picked up by being in unventilated indoor spaces with people who are emitting the virus. It took them a long time to update that fact because they're precautious. It's taken them a long time to update the fact about outdoor transmission as well. They were a little bit ambivalent on the notion of outdoor transmission. Now they say as much as 10% risk of, or 10% of all cases being transmitted outdoors. As David Leonhardt of the New York Times pointed out, it's probably 2 orders of magnitude less, probably 0.1% of all cases being transmitted outdoors. So big picture, because I've talked about a lot of stuff there. The CDC is overprecautious as a general rule, and we probably want them to be overcautious because they're a public health institution. But at the same time, as we're normalizing our lives in this in-between period between the high pandemic winter and the low pandemic summer, I think we also need to use common sense and recognize that just because the CDC says that something is unadvisable doesn't mean that it's not safe sometimes to engage in that behavior, the same way that I engage in cooking sunny side up eggs all the time.
Shefali, you I think have expressed some interest in certainly you did earlier, how news organizations get their message out there, different channels, distilling the message, perhaps even more than we did before. What have been your thoughts? What have you learned about what journalists, news organizations should be doing when we're dealing with this big public health dilemma?
People don't read Twitter. People don't check like a million different newspapers and publications a day, which, I mean, it would be great if they did because that is how I get my news. But we need to be more thoughtful about figuring out where people are, right? And I know that's really complicated, and that requires a reorienting of a lot of our industry, right? Because for arguably for worse, we have for a long time assumed a readership of media that is mostly white, mostly men, mostly right, middle and upper income. That's not helpful when we think about anything, but especially a virus that affects everyone, right? And that means thinking more critically about other alternative newspapers, alternative radio stations, alternative TV stations, social media platforms, right? Thinking about hiring staffs that are more diverse, right? To actually reflect America and who can talk to folks with expertise and with lived experience, right? I think if anything, the fact that we saw in this past year an industry that wasn't able to speak to all people, especially when we saw misinformation targeting, in particular, right? We saw misinformation targeting Latinx folks in WhatsApp and targeting Black people in other social media platforms and targeting women with claims of infertility. We need to be much more reflective about having staffs that can engage with people where they are and understand who they are, and then provide information accordingly.
Elizabeth, what do you take from this in terms, particularly also Kaiser Health News and its mission and its priorities?
Yeah, this really speaks to the decisions we make every day. I think before the pandemic and this massive healthcare misinformation, we were really focused on certain publications, some of the bigger media outlets who we partnered with. We have a longstanding partnership with NPR and PBS News. And what became really apparent is that we were speaking to the converted mostly. And so we had to figure out ways in placing our stories, and all of our stories are free, right? So anyone can use them in their publication to get out to the little newspapers in Montana, in the rural Colorado, in the Midwest, who, some of the more conservative communities. And that's hard because I think, there are news deserts all across this country where there ain't no local newspaper, right? So, and I think that was a big problem. And we've really made big efforts in this year to develop those on the ground ties to whatever news sources are there, whether it's local talk radio, the little weekly newspaper in a county in rural Montana. But I think, they're not listening to NPR or reading the New York Times or the Washington Post. So you got to get this information to people where they are.
I don't want to oversimplify this, but to what extent do you need to get to the Fox viewers?
Well, they do also read their local newspaper. So yes, you do, but you will not be able to say what I would say and what our reporters would say on Fox News. So that's not an option. So we do have to think of kind of Hail Marys, end runs, whatever, how to get to people in more granular ways. And they're out there, and there are hundreds of local news startups that are really, really good out there, and you got to get there.
So I don't want to be too pessimistic, but it does seem that what we have seen here is that fear and confusion are very powerful motivators. And I wonder if there's any sense that we ran up against the limits of facts, because fears don't respond well to hard facts. And I know, Elizabeth, you said at one point early on, I think it was maybe in the summertime, you said, we don't need to give people more facts. We need to scare them with messages. Yeah. Derek, I kind of like your take on if we are sort of bringing books to a knife fight. What should we do? What should we take away from this? What can we learn?
I want to answer that question by talking a little about nuance and what I think about nuance. I think nuance is important, but I also think it's overrated sometimes. The key is not to give the most nuanced view, but to give the most simple view that contains nuance. The genius of the Japan 3 C's formula, closed, crowded, close, is that it's not nuanced. It's 3 C's. It's so simple, but it contains within it a lot of nuance, right? People, if they remember the 3 C's, can decide for themselves whether they're in closed or crowded or close places and just carry those 3 C's with them. It's why I've been trying to get people to see COVID-19 as an indoor talking disease. Now, does indoor talking contain 100.00% of everything you need to know about this virus? No, it doesn't. But I think it contains like 95% of what you need to know. And if we could have found a way for people to remember indoor talking, or really what it means is indoor exerted breathing, aerosolized breathing, as the danger of this disease, then they would have understood to avoid indoor restaurants. They would have understood to avoid gyms. They would have understood to avoid unventilated indoor spaces, and that they're safer being outside. So I think if public health communicators and journalists can find ways to make the complex simple, understanding that their messages will degrade as they go to other platforms, right? When Fox News quotes me, they're going to degrade my message. When a conspirator quotes me, they're going to degrade my message. I think you want to find the simplest explanation for these complex phenomena that contain complexity within them, and that's the way to explain things to people. I think, frankly, that the CDC has not done that. I think that they've sometimes taken little bits of this disease and fail to give people a kind of gestalt view of what this disease is, how it works, that people can take with them into their lives. And so for the next pandemic, I want us to focus on that thing. How do we find the simple answer that contains the complexity that is true?
Could I throw a follow-up question in there?
Go for it.
Just one thing that I'm thinking about as you're saying this, though, Derek, right, is early on in this panel, we talked a bit about how consensus changed over time. And one of the concerns we're starting to hear, right, is that if the virus continues to mutate unabated, especially in other countries with low vaccination rates, that we could someday see a variant that does have greater outdoor transmission risk, right? Or that could spread from kids. So how do you adapt that sort of a simple but nuanced message to accommodate the potential for this kind of change that might make that simplicity no longer accurate?
Yeah, it's a fantastic question, and I don't have a perfect answer, but the best answer that I have is you change your messaging when the facts change. right now, the facts haven't changed yet. The variants are real, right? The variants are more transmissible and sometimes they're more mortal. But their ability to transmit and, by contrast, disperse in the open air outside has not seemed to change very much. And it's meaningful that Japan, which had an experience, and South Korea, which had an experience with SARS-1, with MERS, with other coronaviruses in the last 15, 25 years, understood how to communicate about this disease better than we did. I wish we just took a page from the Eastern Nation playbook earlier, understanding that they were ahead of the learning curve of us, and took a lesson from Japan in simply communicating what this disease is in a way that's memorable, but contains the nuance we want people to take with them.
Can I just take a little bit? I'm not a huge defender of the CDC, but part of it was the CDC was muzzled through most of this, I mean, effectively. And I think that opened the door to experts of every flavor. I mean, I objected both on the left and the right. I mean, people were mouthing off on all sides who really didn't know and weren't very qualified. And I would go like, why is this radiologist, the expert I see every night on TV, it was like open house to anyone who wants to call themselves an expert. So I think yes, the CDC wasn't very good, but they couldn't really knock Donald Trump off the pedestal and say, we've got the truth. They weren't in a position to do so.
But I do want to follow up on something with you, Elizabeth, and that is a lot of this discussion depends on individual decision-making. Get the right message out there, individuals will make the right choice. But in a public health crisis, sometimes you need to shut down the gyms. Sometimes you need to take a global approach so that you're not relying on each individual. And I wonder if that captures some of the limits of the communication strategy. As much as we love it, because we're in that biz, but to what extent do you need trust in public health and government institutions, state houses, and so forth, to make decisions that are going to be necessary at the public level, population level?
Sure. I mean, that's, one of these things that everyone always said of American individualism. We don't like being told what to do. That's terrible for public health. This should not be your decision because it affects me and affects my kids in the classroom. Why was that not true in the polio epidemic, which, in the polio epidemics of the 50s and 40s, which were, most people who got polio didn't get sick. Most of them were asymptomatic, but somehow that was post-World War II and at a time where we were all in it together. So people lined up and got their shots. Now it's a really different world. And I think, this American individualism thing is kind of nonsense when it comes to public health. It shouldn't be. We should never have framed it that way. And I do fault a lot of the politicians for saying, people have the right to make their own choices. Well, sometimes yes. And, in this case, really not. I don't have a choice to go 100 miles per hour on the highway. We regulate all sorts of things, but we were very loath to do it in this case.
Well, we are essentially all out of time. This has been a great conversation. I want to thank all of you. This has been wonderful. You've been generous with your time. We've been talking about COVID and misinformation. Our guests have been Elizabeth Rosenthal with Kaiser Health News, Derek Thompson with The Atlantic, and Shefali Luthra from the 19th. Guys, absolutely wonderful. Love all of your experience. Love what you brought to this discussion. Thank you.
Thank you.
And we really appreciate all of you who've been joining us and listening. Coming up in 5 minutes, we're going to hear live from Dr. Anthony Fauci, and you don't want to miss it. So stick around. Thanks.